Pelvic floor disorders are so common, we estimate 1 in 3 women will experience a pelvic floor problem in her lifetime. Unfortunately, the common mistake many women make is to think it's a problem of old age or menopause. But that's not true. Pelvic floor disorders at any age are abnormal, and even younger ladies in their 20s, 30s or early 40s can develop the problem. But what exactly are they? And if they're so common, how can you avoid being one of that group of women who suffer from pelvic floor disorders? Hi, welcome to the channel. I'm Dr. Sylvia, a general practitioner and health educator with Ask Away Health. On my channel, I share health videos every week that teach you about your body and help you live well. If you'd love to get those kind of videos, make sure you subscribe and click the notification bell so you know every time a new video comes out. Your pelvic floor is a network of muscles, ligaments and tissues sitting at the base of the pelvis. The muscles and tissue make a solid base to support organs like your rectum, uterus or womb, the bladder, the vagina, the small bowel in the pelvic area and keep them in place. Pelvic floor disorders happen when the muscles become weak or if there are tears in those connective tissues. And when this happens, 3 types of medical problems can develop. 1. Bladder control disorders. 2. Bowel control problems. And 3. Pelvic organ prolapse. Now let's take a brief look at each of these conditions and what they mean, starting with bladder control problems. If you have problems with bladder control, you may not be able to hold your urine long enough to reach the toilet. Or you might leak urine unexpectedly or when laughing or coughing. Another common symptom is that you might have to go and pass urine several times during the day or night. Secondly, if you experience problems with bowel control, you may develop constipation, which means you struggle to pass stools regularly and your motions may be pretty hard as well. Another bowel problem that develops is known as fecal incontinence. With incontinence, you may fart or pass liquid or solid stools without realizing you're doing so, or when you laugh or cough or bend over to lift something heavy. And the last category, pelvic organ prolapse. This happens when organs like the bladder, the cervix or rectum drop down into the vagina because the support holding them in place has become weak. In this case, you may experience a bulging in the vagina, sometimes accompanied by a dull, dragging ache in the same area. Now, any of these problems is just awful to experience, not just physically, but mentally and emotionally. Sometimes until they get diagnosis or treatment, some women resort to just wearing continence pads and enduring the symptoms. They can be very hard to talk about, and sometimes, depending on how severe, they could take some time and quite a bit of effort to treat. For example, there are non-surgical options like pelvic floor physiotherapy and exercise, drugs, vaginal pessaries and other supports, bladder Botox, and nerve stimulation. But there is also surgery to repair the pelvic floor. However, prevention, as they say, is better than cure. Are there any measures you can take to prevent the risk of developing a pelvic floor disorder? Yes. Number 1, maintain the strength of your pelvic floor. Like any other muscle, the pelvic floor system also needs to be kept supple and active. Otherwise, over time, it may simply weaken as you get older. You can do so by maintaining a strong core and practicing pelvic floor exercises. Check out this great video from YouTuber Ask Dr. Joe on how to do pelvic floor exercises. Women with weak pelvic floors can also do pelvic floor exercises using internal devices like weights and electrical stimulation probes. But there is also Innovo. Innovo is a non-invasive device that can be worn by both men and women. It comes in the form of shorts that you can put on and which help you perform 180 perfect pelvic floor exercises. It can potentially reduce symptoms like bladder leakage in 80% of users after only 4 weeks. And if you're interested and would like to get hold of this great device, check out the link I've placed in my description. Secondly, keep your weight within a healthy range. Being overweight puts pressure on your pelvic floor muscles. You can reduce this pressure by maintaining a healthy weight. Your pelvic floor will support your organs better and help them control the sphincter muscles, which control the opening and closing of the organs. Number 3, when pregnant, practice pelvic floor exercises. They can help the pelvic floor withstand the pressure placed on it during pregnancy and improve the blood flow to the pelvis. All that will help reduce inflammation and swelling to the perineum after vaginal delivery or healing if any tears or cuts happen. And if you want to learn more about that, make sure you check out this great video on my channel as well. 4, learn to protect your pelvic floor if you lift heavy objects or weights regularly. This means you pay attention to your posture when lifting items to limit the strain of heavy weights on your core and pelvis. Avoid prolonged lifting wherever possible. But if you need to carry something heavy, then squeeze your pelvic floor before and while you're lifting. Using mobile trolleys and lifts is also a helpful way to avoid pressure on your back and pelvic floor. Number 5, diet. Eat fibre-rich foods to avoid constipation. Eating foods high in fibre can relieve the stress on the bowels, preventing constipation. Now, spicy and acidic foods irritate the bladder, while sugary foods stimulate it, and all these worsen the symptoms if your pelvic floor is already weak. Also, avoid excess caffeine, fizzy, and some acidic drinks like tomato juice can improve your bladder control. 6, stop smoking. Smoking irritates the bladder, which makes you need the toilet more often. You will also cough more if you smoke. Coughing puts a strain on the pelvic floor, leading to bladder or bowel leaks and prolapse. 7, watch your alcohol. Alcohol doesn't cause incontinence, but if you have a tendency to a weak pelvic floor, drinking large amounts of alcohol can make you more likely to develop bladder leaks. Alcohol relaxes the bladder muscles as well, meaning you need the loo more often. Some helpful ways to reduce the effect of alcohol is to take lower strength spirits and reduce the quantity that you're drinking. Number 8, healthy bowel and bladder practice. Some people get into unhealthy bowel and bladder movement patterns over time, worsening pelvic floor symptoms if they develop. So, check your habits to see if you're doing anything that could make the problem worse. Use the toilet regularly, and if you can, avoid holding on to your wee or poo for hours. Go to the toilet at night before bedtime. Drink 6 to 8 glasses of water a day. Doing this improves your bladder's capacity to hold fluid and also reduces constipation. Now, did you know some conditions make you more at risk of pelvic floor disorders? Yes, they do. Number 1, pregnancy and vaginal delivery. In pregnancy, the increased abdominal pressure strains the pelvic floor. During vaginal delivery, the floor may also experience some damage, especially if a woman gets a perineal tear or cut when she is in labor. And you can check out my video here to learn how this happens. Number 2, chronic respiratory conditions like asthma or COPD. If individuals cough for prolonged periods, they strain the pelvic floor because coughing puts pressure on your abdomen, which transfers to the pelvis. Number 3, genetics. Some women may be genetically predisposed to developing a weak pelvic floor. If you have a close family member who experiences this problem, taking these prevention tips can help reduce your risk of getting them as well. Number 4, surgery to the pelvic area may accidentally damage the nerves to the pelvic floor. For example, during a cesarean section, although this is quite rare. That's it. Thank you so much for watching. I hope this video helps you keep a healthy and strong pelvic floor. Let me know what you think in the comments section, and if you have any questions on the topic as well. If you would like to learn more about women's pelvic problems, make sure you check out this video here looking at acute causes of pelvic pain. Next time, I'll be talking about some side effects from the contraceptive depot shot. So if you haven't already subscribed to my channel and you're interested in that topic, what are you waiting for? Don't forget to click the notification bell so you know when we publish new videos every week. While you're waiting for the next video to come live, check out these two here, and I'll see you again soon.